Welcome everybody to this morning's Children, Adults, Health and Wellbeing Policy Development and Scrutiny panel, which is taking place today. One day that clock will be fixed and that will throw me as well. So welcome to everybody. I'm just going to ask us to quickly go around the room so that everybody knows who everybody else is. So my name is Dina Romero, I'm a councillor in South Down and I chair this panel. Liz.
Good morning, I'm Ms Hardman, I'm vice chair of this panel and I represent Porton.
Chris?
Chris Button, cooperative member, education.
Oh, could you indicate if you can vote or not?
I'm non-voting.
Michelle, Deputy Councillor for Newbridge.
Kevin?
Kevin Burnett, cooperative member, non-voting.
Thank you. Joe?
Councillor Joanna Wright, Lambridge Ward, voting.
Alex?
Alex Beaumont, councillor for Keynsham North, voting.
Dave?
David Harding, councillor for the Chew Valley, voting.
Councillor Paul Crossley, South Down, voting.
Okay. Kerry?
Morning, Kerry Williams, supporting scrutiny officer.
Thank you. And Mark?
Morning everyone, Mark Downford, Democratic Services Officer.
I'll start with you, Laura.
Morning everyone, Laura Ambler, I'm the Director of Place for Baines for BSW Integrated Care Board.
Dom Hall, BSW Integrated Care Board, Comms and Engagement.
Thank you.
Teresa Cleverly, Programme and Project Manager for Baines Council.
Thank you.
Good morning everybody, I'm Natalia Washcom, the Assistant Director for Integrated Commissioning.
Thank you.
Good morning, I'm Judith Westcott, I'm the Senior Commissioner for Transformation and Change.
Okay, Alison.
Hi, Alison Bourne, I'm the Councillor for Whitcomb and Lincoln and I'm the Cabinet Lead for Adult Services.
Claire.
Good morning everybody, Claire Thorogood, Assistant Director, Strategy, Transformation and Governance.
And the bringer of the scary noises.
Morning everybody, Anne Smith, I'm the Assistant Director of Adult Social Care for Baines Council.
Okay, thank you everybody. And now moving on to the emergency evacuation procedure. Mark?
Yes, great, thank you, Chair. So, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area, just outside Brown's Restaurant. There's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you very much, Mark. Apologies for absence and substitutions, please.
None that I'm aware of.
Thank you. Okay, I'm aware that we do have 2 vacancies on this panel, but Liz and myself will be looking at that separately. Okay. Thank you. Any declarations of interest? I'm on item 4 now. Okay. There is no urgent business. And now I'll move on to public councillor statements and questions. And I see no members of the public here, nor any other councillors, so I assume there are none to make. I do wonder, though, if we could do more to publicise this meeting so that we actually have members of the public, because I think it would be useful to hear directly from members of the public how things that are being discussed impact on people who aren't in this room. Okay, so perhaps we could talk about that at some point. Yes? Okay, thank you. Moving on to item 7, which is the minutes of the 18th of September 2023. Our meetings are slightly peculiar because we move between a child-focused meeting and an adult-focused meeting. So I'm going to take any matters that arise to be agenda items or to pick up if necessary at our next meeting, unless of course there's any directors here who will be able to answer any of those points that are made, just so you're aware. So can I first of all check whether or not the minutes are an accurate record of that meeting?
Yep.
Yes? Okay. And I assume we need to vote on that?
Yep.
Yes? All those in favour? Thank you. And all those who don't vote, thank you for not voting. Good. Okay, so are there any matters arising from those minutes that anybody would like to raise, bearing in mind, of course, that it is highly likely they'll be picked up for our next meeting? Any points anybody would like to make on those minutes? We're on item 7, the minutes. Kevin?
Yeah, I thought, Chair, they're probably wise to pick it up for the education next meeting, and I'm going to bring up some of the questions for the ICB in the report, if that's okay, in their update.
That's great, thank you. Thank you, Kevin. Then we move on to the Cabinet Member update. So yes, over to you, Alison. Welcome to this meeting.
Okay, thank you. I assume that you've all had a chance to read this already, so I won't go through it in detail. But the report includes something on our current performance and also on finance, noting that our financial situation is we are under more pressure currently. I think over the pandemic there was a backlog of cases that built up, and we've been doing a lot of work to clear that backlog. And obviously that's resulted in more people coming through needing packages, support, etc. So that plus inflation and other factors has put us under some pressure financially, which obviously we're working on very actively. The Local Government Association peer review is on the agenda, so I won't say anything about that. Just to note that our provider services, we are about to start on a piece of work with our provider services. We've undertaken an internal review, and we're going out to consultation on potential changes to those services. And that consultation is about to start now, is that correct, Anne? Start in 2 weeks' time. Sorry, okay, despite the microphone.
If you speak into the microphone, Alison, you might have to just lean forward a bit.
Okay, right, apologies. Then there are a couple of bits on various commissioning changes we're making and things we're introducing, like the Community Catalysts programme, some work we're doing with Age UK on age-friendly communities, and the new supported living schemes that are due to open later this year for people with learning disabilities and autism. We're working on developing a new strategy for our carers, and that work is in progress. And also it covers the community services transformation, which is also a main agenda item, so I won't go through that. So that's a brief summary, and I'm very happy to take questions.
Thank you very much. So, panel, questions? Kevin?
Yeah, thank you. On the community catalysts, is there any council money involved in that, or is that providing through third party and other funding somewhere else? Because it sounded quite exciting.
It's better care funding, isn't it? Yeah, I'll defer that to Natalia.
So we are funding the project, not the delivery of care to individuals. And the project has been funded from last year's allocation to Baines of the Better Care Fund, which is a national fund to invest in innovation and different ways of meeting the needs of local residents. So that's where the project itself is funded for about 2 years, to show us how it can be set up and what the response is. And you've seen from the report so far, it's been really welcomed positively. When the community catalysts are registered and trained and are operational, then there are 2 funding streams for them to exist. It's either through a personal budget for people who are eligible for social care, and that would be council funding, because that's our responsibility to meet the statutory needs, or people who themselves, with their private finances, purchase those services as they do a lot of other things of care and support. So we're funding the project, but longer term, there are two funding streams, either social care from council or individuals' personal finances.
Sorry,
can I just say one thing? I know that it was a very quiet response, but thank you for the response. But I have asked for the microphones to be turned up a little, but hopefully they won't get turned up so they go squealy. But bearing that in mind, could you speak into the microphone and be really clear about what you're saying? Thank you.
Yeah, yes, sorry, Chair. Yes, I need to do the same. I'm trying to sit on the edge of my seat here to make sure it happens. So as far as new funding is concerned, there isn't any extra being pulled in from elsewhere. It's either... No. Okay, thank you.
Thank you. Liz.
Morning. Alison, thank you very much. Your report was really meaty. Thank you. Obviously, a lot of it is repeated because you're covering all the other items that are on the agenda. So there are one or two things I'll be asking later on. But I wondered about the future plans for the home care service. Sorry, am I shouting? I sound lovely and clear.
No, you're a good example.
Thank you. 10 out of 10. But what future plans are there for the home care service, and what decision are you going to be taking in January 2024 about this? That's for you, but I'm happy if somebody else wants to answer that.
Hopefully you can hear me. I'm quite loud anyway. So the home care service is currently delivered in partnership with the Royal United Hospital. That partnership lasts until June next year, and that partnership has been around international recruitment and international recruits being seconded into the council. In January we will be starting to look at the options for that service going forward, and how we do the recruitment. We are starting to recruit from the council to look at people who are currently looking for jobs in the care market. So we'll be taking decisions mainly on the recruitment and looking at the model for that service going forward. It is delivering quite a lot of care for Baines Council. It has been quite successful, so we're just looking at the longer term future.
Difficulty getting this on. When we were looking at recruitment in the report, you were saying that you're now saying you're looking at overseas recruitment, and there are all kinds of difficulties with that. I mean, a whole host of problems. So are you concentrating mainly on getting overseas people to help out to work in the care sector?
The original recruitment that was undertaken by the RUH for the domiciliary care services was directly overseas recruitment. We're now looking to stop the overseas recruitment. We've had quite a number of people, over 30 individuals, mainly who were on student visas, so they were already in the UK, and we're starting to look at now undertaking local recruitment. So it's served a purpose and it's helped us get the service off the ground. There have been some issues in terms of just making sure that everybody could drive, or that we've got the right references, that everything is in place. But sponsorship visas only last for 3 years, so we need to make sure that we don't have a gap.
And just one last question on Alison's report. It's good to see waiting times have been reduced for residents waiting for a Care Act assessment of their needs. But I still think we need to flag this up, that the average wait time is still 8 months, and can anything more be done about this?
So our averages are based on everybody who we're assessing at the moment. It may be helpful for Scrutiny if we can start to break that down. So the reason why the average wait goes up to 8 months is that we include our young people in transition in those figures. We include our complex adults. So those assessments often take longer, where a person who's been discharged from hospital and is having their assessment, they can happen in a couple of weeks. So it might be helpful if we break those figures down, because it's slightly skewing the figures.
Thank you. Paul, Councillor Crossley.
Thank you very much. Very interesting report. Thank you. What is also interesting to me is to see whether the trends are going up or down. And you've done that with most of the paragraphs except the safeguarding one. So did that go up or down? But the question I've really got is I'm concerned about the mental health one particularly. 10% month on month doesn't sound much, but if it's 10% month on month, it gets to a point where it just escalates incredibly. So what is driving that increase, and how does that compare and contrast with other authority areas?
I'll take the safeguarding one first, if that's all right. The Baines Safeguarding Community Partnership is about to publish, has just published their report. So we are seeing an increase in safeguarding. It has gone up. The numbers of people who are referred to us for safeguarding have gone up. The number of people where we talk about a threshold, that actually go on to have some kind of investigation are fairly static. So what you often see is when you start promoting safeguarding and making sure that people know to make referrals or to approach as if they're concerned about a vulnerable person, you often see those numbers go up. And we have done work around promoting what safeguarding can do. It isn't translating into people then who have been harmed, but I'm not too concerned when we get an increase in people coming to us and saying, I've got a concern, what should happen for this person. In terms of mental health, we are in line with other areas. So across Avon and Wiltshire Partnership, we are seeing a rise in requests for assessments under the Mental Health Act. Again, they aren't always translating into detention because we have a very robust diversion programme, but it is in line with both the South West and national trends. Again, I think, as Alison said, it's another symptom of a couple of years on from COVID. We have seen people whose mental health has deteriorated, but our AMP service is under some pressure because of the requests for those detentions.
What's really concerning me is that where's the money going to come from? Because if packages are going up by an average of 12% and the number of people are going up by 10%, we're going to have no money left unless we have a big budget increase in the autumn when we discuss our budget for next year. So what's being done to prepare council for the fact that this is a really dramatically increasing area, and it's one that we can't just walk away from?
So if I take the question on the workforce about the approved mental health professionals, we are currently doing some work now on what our staffing establishment looks like, and where we focus on having a social worker or an approved professional or an occupational therapist versus some of our non-registered staff. So we are staying within our budget and looking to build in more approved mental health professionals. So from 1st of April onwards, we'll be looking at 2 additional specialist posts. Similarly, we've just agreed to go to recruit for 4 apprentice occupational therapists as well, and we continue to look at the mix of the workforce given the budget that we've got.
Can I just add something? I mean, the pressure on the finances at the moment is partly due to this sort of bulge in the amount of work that we've done because we've been working through the backlog and through some built-up demand. So we are looking very closely to see whether that is something that's sustained or actually if it's a short-term thing and then the demand should go back more to where it has been. But obviously it is a concern and it's something that we will have to be discussing and looking at in budget setting. And we're doing a lot of work to look at all the costs and where our expenditure is going and ensuring that we are using every penny that we've got very wisely. Just in relation to mental health and the question you raised there, Paul, I'm aware that there's nobody here from mental health, and I wonder if it would be helpful to have a future agenda item looking at that, because it is a real challenge, and I think it would be helpful to have a more detailed discussion on it.
Thank you, Alison. Actually, I'd made a note of it when Paul had mentioned it to add it to our work plan, but whether that comes under our children's section or adults, I think we'll have to look and see how, because actually, it's right, it is absolutely both. Joe? Is it on mental health?
Yes, it is. So I was actually just looking at the Cabinet papers for July, in which it actually says that adults and older people, mental health and commissioning, P20, that we have an underspend of 528 of 1,000. So it doesn't make sense what everybody's just saying.
Thank you. So perhaps we can look at that in detail when we have our agenda item, but if you've got an immediate comment to make on that point, that would be welcomed.
Thank you for raising that. The budget underspend that you quote there is around the packages of care that people receive in the community, so the things that we buy to support them. The pressure that we've talked about in the report is about the staff capacity to undertake the Mental Health Act assessments and the assessments. But I appreciate that comment that it doesn't seem to add up, but there's a staffing budget and then there's a care budget.
Say that the Cabinet papers need to be a bit more thorough in what information they give us and how much division there is between that, because it's not clear. That's Paul.
I'm sure that point will be taken away unaddressed. Michelle?
Actually, Paul asked the question I was going to ask, so we can pass.
Thank you. Alex?
Thank you for the report. Would it be possible to get a brief update on Charlton House and what's going on there?
So, Alex, are you asking for that right this moment?
Well,
yes, okay, let's see how it is then, so if we need a more thorough report.
Yes. So we've undertaken a review of the 3 care homes, including Charlton House, and a single-member decision to consult on our future plans for those 3 care homes will be published on the 12th of October, and then, as I say, we're due to go out for a 6-week consultation towards the end of October. So Charlton House at the moment continues to improve, but we continue just to have 1 floor and a small number of residents in the building. So until the outcome of the consultation is known, I can't give any further update in terms of what future plans are for the care homes.
When did you say you was expecting the consultation?
The consultation will go live at the end of October, and it will be live for 6 weeks in the public domain.
Thank you.
Sorry, would you just confirm who is being consulted with?
So it is a public consultation, but there are separate forums for staff, residents, relatives and the public in terms of our plans around the 3 care homes and how we want to shape them going forward. So it's in the public domain.
Thank you. It would be quite useful, I think, to somehow find a way of including those who are potential residents as well. Have I missed anybody who wanted to ask a question? Joe?
Yeah, further on the Cabinet report, thank you. You mentioned the new supported living scheme. And I'm just wondering, as a ward councillor, I've had quite a few complaints about Curo and their lack of ability to support their Curo residents and mould in properties. So I'm just concerned about the process for delivering this through Curo and how we will be making sure that there are not the issues that I seem to keep having questions about from residents.
So if I talk about these two schemes, they are new build properties. So both the care and support and the housing is new. And there will be, so the standards the properties have been built to are the current sort of modern standards expected. So there will be a partnership between Curo as a landlord and the care and support provider, for whom we are currently out to tender. I think the contract award is imminent. So there will be that additional relationship and oversight around not just the quality of care, but also the quality of housing. On the general point of Curo as a landlord, I think it's a question to housing colleagues, so I don't have that information, but that's something we can take away and get a response back.
Chair, could I ask that something is brought to this Scrut about housing, because it is a serious issue?
I think we'll have to be careful on how we put that question, because obviously it could be about housing, but I think maybe the health implications and the consequences would be appropriate. I do know that the Health and Wellbeing Board looked at poor quality housing some months ago. I don't know if it's still on their agenda, but yes, I'm very happy for it to be included on this.
Okay.
I'm very sure Kerry's making a note of it.
Thank you. And then further, you talk about the community services transformation through the ICB. I just wonder who is the democratic representative on the Integrated Care Board?
So the Integrated Care Board is separate from the Integrated Care Partnership. So the Integrated Care Board, the representative for Baines, for example, would be Will Godfrey. So there are partner members. There are also nominated members from the third sector, etc. And then the Integrated Care Partnership is chaired by Richard Kluwer, who's the leader of Wiltshire Council.
Okay. I guess because we're such a new group of people in this room, sorry to just sort of pick you up, but there was an awful lot of acronyms and groups of people in different places. I just think that it would be really useful to have a proper structure of what takes place, who goes to whom, and how those conversations are fed through to where. Because at the moment, it's just such this unwielding thing that means nothing to most people. So how do we expect the average person to come in the room and understand anything that's just been said, with no disrespect to you? Thank you.
No, I understand that. We have a slide deck that I've presented previously to the previous scrutiny panel. I'm very happy to circulate that, or if it's more helpful to talk that through, I can do that, and that sets out membership on those different groups. That's no problem. It's a very valid point. It's complex.
It might be also quite useful, I think, to have like a structure chart at the end of these papers as a standard item, as well as an ongoing glossary of terms, because as we all know, what means one thing in one type of work might mean something entirely different in another area. Sorry, can I just pick up one thing? And if it's not necessary to use an acronym, could you use the full name? That would be even better. Thank you.
Thank you. And then just one final thing, age-friendly communities. Again, something I heard on the radio recently. Pension credit. There's an awful lot of people don't know what pension credits they should be getting, and therefore thinking about how we support our residents in getting education into health plans. How do we also support our residents into knowing what support they should be getting through pension credits?
As somebody, Alison, are you going to respond to that?
I think that's certainly something that people who are in receipt of social care assessments, etc., often their entitlement to benefits, pension credits, those sorts of things are looked at as part of that, and it's something that the Compassionate Communities Hub would be helping with, and also Age UK, I think, does a lot of that. So I think there is, there is work covering that, but it's whether it is reaching everybody who needs to, and I think that's always the challenge. Also, obviously, Citizens Advice Bureau, it's something that they've done for many years.
I mean, I understand that actually through government there's meant to be legislation for an education health plan through local councils. So I'm just wondering how that is picked up and then delivered. That would be my question.
Is this something we need to come back to, do you think? Okay, so we'll make a note that we need to come back to this point. Are there any other questions on the Cabinet Members' report?
Could you clarify what it is?
Under legislation, local authorities are meant to deliver educational health plans, and I'm just wondering how we're delivering that and what processes are we making sure that everybody knows about their entitlement in terms of pensions. To stay healthy, a lot of old people don't have warm homes, don't have good food, so therefore if they have the right pension, then hopefully it costs us all less.
Well, we might also need to have some additional officers in the room for that item next time. Thank you. Okay, I'm going to move us on now to the report from the BSWICB. Can I just make a comment before you start on this, Laura, that for this panel, we want to know that we are being asked to do something. I mean, obviously an update is very useful, but it would be, I think, helpful for us to know whether we are merely to be noting this, if there's any expectations of us, and so perhaps you could bear that in mind for the future, because it also means that we can tailor our questions and perhaps our lines of inquiry appropriately. Thank you. And sorry, are you doing this rather than Alison? I was under the impression that all papers were coming here now through the Cabinet Member, but
I think not the Integrated Care Board paper, although I do work obviously very closely with council colleagues when I'm preparing it, because we are working so much jointly across so many programmes. But Chair, thank you for the helpful steer in terms of being clear on what we're asking for with this report. It's labelled as an update report, so what I'll do is, as I go through, there are a number of sections in it. I know you've had a chance to read it, but perhaps if I just pull out the salient points and bear in mind your steer there, Chair, of where you've guided me to. So a number of things that we cover here. So one is prescriptions ordering direct. So just some key headlines on this. So this is the prescriptions ordering direct service. And as an Integrated Care Board, we've developed a proposal for an organisational change to that service in its current form, and to look at potential options for the future of repeat prescribing. There's a full update with background and context, but some key points. We need to ensure equity across all partners. That's one of our purposes as an Integrated Care Board. And currently, the prescriptions ordering direct is not offered equally. It serves, for example, 24 of the 87 practices who choose to opt into services for repeat prescriptions, just one in Baines, and some care homes. So currently there are 63 practices who are not signed up to that, that manage their own repeat prescriptions internally, or they do it via the NHS app. And of course, a lot of this is because the context has changed since POD was first launched in 2017. Now, there's an ambition in the delivery plan for recovering access to primary care to enable patients in over 90% of practices to order by the app by March 2024. So that's a key consideration that we'll be looking at. We have also looked at whether we should scale up across the whole system, but it's clear that the levels of financial support to achieve that are just not there, and this can be seen across the country. So we will be looking at other options, including digital, but also practices and community pharmacists playing a more important role, and crucially being that face-to-face role to help patients experience. So at the moment, Chair, just bearing in mind your steer there, no decisions have been made. We are at this stage engaging with stakeholders and our staff ahead of a formal consultation So there's an opportunity here for us to speak to stakeholders and hence bringing it to you as a scrutiny panel. That engagement period is up to the 2nd of November. We've also written out to all practices for their views. So they're the salient points, I think, Chair, for panel members to consider on that point. And if I may, I'll just run through the rest of the report and then take questions at the end. So the next section in the report is around the primary care and community delivery plan. The report introduces this concept. It's based on all of the engagement that we've done to date, and you'll know that we've rehearsed some of that through the care model, through the integrated care strategy, and through the implementation plan that we've worked on jointly. Now, the purpose is to set out the priorities to deliver transformation for community and primary care. And there are 6 priorities identified. They're listed in the report. They were agreed by all our partners at the Integrated Care Board, but we're now again further engaging just on how they will be delivered. So again, just to give panel members a steer, we're not seeking formal comments on those 6 transformational priorities, but just rather consideration of what we need to do next and who we need to work with to be delivering those. The next section of the report talks about winter planning, and I think it's fair to say, as we all know, that we are in a very challenged system. We've heard some of that through the Cabinet members' report, but I have to say that operationally we have been working together jointly. As you will know, that we have a Home is Best programme, a significant amount of work there with my colleagues, so Judith, Natalia and others, also working with our acutes, with our community hospitals, and indeed across health and the third sector. And you'll remember that the aim of that Home is Best programme is to keep people at home, to reduce reliance on bed-based care, and to improve patient outcome and experience. And I have to say, it's really helped and managed patient flow, and we are on track to deliver our plans. Now, I think it's fair to say that we haven't really been in this position going into winter before as a BAMES locality. So, for example, the sorts of things that we measure to tell us how well we're doing are things like non-criteria to reside. Now, that's currently below 30, which is what our planned trajectory was, and it's actually been as low as 3. So it's just 3 individuals. To put that in context, this time, sort of last year, we were often reporting numbers between 80 and 100. So the amount of work jointly by colleagues is really amazing. It's a significant achievement. Things like discharge to assess beds, as we heard in the Cabinet report, the Cabinet member report, we've done really well on some of those Care Act assessments, etc. And we've been looking to reduce reliance on discharge to assess beds. So we're down to 31, which is below the target of 36 that we had. And we've got lots of flagship programmes running, like our virtual wards programme that I've come and talked to you about before. So we're in a really positive position to start with, going into winter as a locality. However, there's always a but, isn't there? We know the system as a whole is still under immense pressure. And we also know, as we have heard, that sometimes when we have some of those successes in some parts of our system, there may be implications and pressures that are created in other parts of the system. So we need to keep a watching brief on that, and we need to do further joint working together. So this is not a time to be complacent, but certainly I think it is a moment to pause and reflect that there's some fantastic work that's been done to get us here in as good a position as we could be, but obviously there's always more to do. If I may move on to the next section then, Chair, the Community Investment Fund, and actually this speaks to some of the points that you were raising, Councillor Wright. Some of you may remember that we had a Community Investment Fund that we allocated through Quartet to a number of third sector organisations to help us target those individuals and get this funding directly to the people that need it for things like warm homes, so particularly in direct response to the health and wellbeing request around mould, etc., but also food and clothing and other grants. And we've heard some fantastic anecdotal evidence. It's been very successful. So it was just to flag that on your horizon, really, that we'll come back. We're evaluating it more formally, and we'll come back with case studies as well as evaluation. Sorry, trying not to cough down the microphone. And then if I may just finish perhaps, rather than pick up on all the points in the report, a really good news story with our one of our ICB third sector partners, Bath Mind, have opened Orchard House. This is providing support to people living in the community who are experiencing difficulties with their mental health, given the conversation we've just had, and need to support to avoid hospital admission. It provides step-down provision as well, which means those who would benefit from support before coming home. So it's a really welcoming environment for up to 4 people at a time, a fantastic resource, dedicated professionals. So hopefully, again, a real good news story. Thank you, Chair.
Thank you very much, Laura, and thank you for being succinct as well. While the rest of the panel digests what you have said, can I just ask you a question, I think, on process? So the 6 priorities that are set here, could you share how and who sets those priorities? Thank you.
Yeah, so the 6 priorities came through the engagement that had been done on the integrated care strategy, which had been quite extensive, and also through the work that we've done on our implementation plan. So that included working with stakeholders across the system, so across acute and community and primary care in particular in this instance, as you would expect, but also third sector providers and obviously their feedback from service users. So that's how we understand the lived experience, voice, etc. So I think the transformation priorities are probably ones that we would expect. I think it's fair to say there are no surprises in there. I think it would also be fair to say that they're the golden thread that comes through the integrated care strategy. As some members of this panel will know, we work quite hard to make sure that what we had as an integrated care alliance in Baines, sorry for another part of the structure being thrown in there, married up with what the Health and Wellbeing Board ambitions were as well. So that has also been taken into account, as has the joint evidence needs from the Baines strategic evidence base that underpins your health and wellbeing strategy. So there's a significant amount of join up in it all, which is hopefully why the transformation priorities will resonate with you, and hopefully you'll see that golden thread running through them.
So is there any obvious political input then into setting those priorities?
Yes, again, I think through the Health and Wellbeing Boards, also through the Integrated Care Partnership, and again, just through ongoing engagement through each of the place localities.
Thank you, Laura. Opening up now to the rest of the panel. Shall I go straight to you, Kevin?
Well, yes. I thank you, Laura, for the report and for the rays of sunshine, which is great. There are some questions that I had from last time that you weren't here to answer, and maybe if I could run through a couple of those and then on, if that's all right. Something that cropped up last time was that the RUH were in their urgent treatment centre, were doing a new triage system. We just wondered how that was going from September. Do you want me to go through the questions, or do you just want to take one at a time?
As you see fit, whatever's easiest for you.
Okay, I'll just give you 2 at a time to start with. And then what's happened to the hospital improvement programme was something you were going to kindly investigate, the HIP2, now that the ICB was created.
Yeah, if I take them in reverse order, I'm afraid I don't have an update on HIP2 yet, but I will take that away again as an action, and apologies for that. In terms of the RUH Urgent Treatment Centre, I have to say that is going very well. It's been positive so far. So positive in the sense that there's been no, unwitting consequences or impacts, that have affected patients' quality outcome or experience, and we are evaluating and monitoring that. And we have some criteria in place with providers so that we are all on the same level of understanding of how we measure that. At the moment, I think it's fair to say we're not seeing any significant impact, but it is under review for a 3-month period, so we will keep a watching brief on that and obviously flag if that changes.
Has that initiative made a difference in terms of saving on resources, or just redirecting things to the place where they should go, but not saving really anything on?
A bit of both, actually. I think it has enabled us to be more efficient in terms of what resources we put where and when. And I think it has actually enabled patients to access the care that they need at the right time and at the right place. The change came in the first instance from feedback from both staff and patients, particularly because we knew that there were long wait times, and sometimes those long wait times were as a result of that, people shouldn't have been there. There was actually another service they could have been directed to, had they have known about it, that would have been more suitable for their needs. So, I think that's the outcome that we've been seeing, and we'll keep that under a watching brief.
Do you want to go on, Chair, or do you want to...
How many questions have you got, Kevin?
About 6.
I think you're joking. Okay, off you go. One
question that popped up last time, and again, you might want to come back with this one, is we understand that there is somebody who is a SEND rep on the ICB. I just wanted to know a bit more about what their role actually is, they've been given, and who they actually work with, and how that may come on to down into other things like education and other services, because it seems, all the services from social care to education have SEND, and it's interesting to see where that is supposed to be going.
Laura, at any point, if you want to say I'll come back with more information, you feel free to do so.
Do you want me to take that one? Shall I? Yeah. So, just very briefly, because I think we will need to come back with more information, and perhaps that's one for your other panel, as it were. There is a designated SEND lead, which is Jill May, the chief nurse. We do have SEND board representation, in each of the localities. So either Jill or a member of her team will be sat on those. And what we try and do is make sure that we have appropriate representation from our executive team in each space. So, for example, I hold the executive lead for learning disabilities and autism, and Sharon Pells, who is the deputy chief nurse, will sit on that board to make sure we have the SEND voice. And likewise, I will go and sit on the Children and Young Persons Programme board, where SEND is often discussed, to make sure that there's that cross-correlation. And we have SEND boards in each of the place localities. So again, it's making sure that every time SEND is discussed, we've got the right people there, and that, it's definitely cross-fertilisation across those different conversations. But we can set that out more clearly, but I guess I'm trying to just reassure you that yes, there is a designated lead, and yes, they are linked into the right structures, and the joint working is taking place, and obviously that translates back into the local authority structures with that SEND board at locality.
Great. Well, more information would be lovely, how it all filters through. Thank you. We mentioned this last time, and again, this might just be to note, and it might have already happened. I think Chris Wolford was going to, or Mary, take it back about a meeting between the council and the ICB around young carers identification and where that's got to. So if you could follow that thread, would be really helpful. And the prevention and early intervention is one of the key objectives of the care strategy, yet there seems to be that a lot of things working around in terms of social media and other media from GPs that actually don't use this service unless it's really important or unless you really need to. So there's two things going on. On one hand, it's saying come to a GP if you want early prevention and so on. On the other hand, it's we can't see anybody today, or we need X, or you can't book a bookable appointment. So what is the actual message? Because the message is not clear at all, really, and where the early intervention comes, people are leaving it if they don't really think that there's an issue.
Yeah, thank you. That's a really valid point, and I think that was partly the driver behind the primary care and community delivery plan. where are those other access points for prevention and avoidance, not just primary care. As we know, our primary care colleagues can often be, as up against it as our acute colleagues. So it's about making sure that we've got the right availability and access to prevention and avoidance, so whatever those services might look like, across our community. So that's why we're trying to get that messaging through the primary care and community-based delivery plan. There are lots of other things that we've got in Baines. We've got fantastic structures in place. Things like the Community Wellbeing Hub, for example, is a real flagship. And clearly that's part of that prevention and avoidance piece, but there'll be many others. And we're looking at things like integrated neighbourhood teams in that space. So that's one to watch. I think when we are messaging about primary care, I'll certainly take that one away back to colleagues in primary care, in the Integrated Care Board. The messaging is often trying to protect the frontline services if we know that things are getting heated at different times, and particularly in periods of things like industrial action, we have to be very careful about that messaging. So I hear your point, and we'll take that away and make sure that the messaging is clear. But yeah, it's not intentional to be suggesting that we're trying to put people off accessing primary care or accessing that prevention and avoidance. It's quite the opposite, but it's making sure that we have the right provision and that we're being clear where people should be going and when.
It's just that where to go and when.
Yeah.
Because if you haven't got somebody who triages, and presumably your GP who knows you, inverted commas, was the triage point. So who is the triage point if you're saying that there's a lot of other services?
Yeah, so our primary care are well worked into the Community Wellbeing Hub, which has got a range of different partners, and they also have referral systems that speak to one another as well. So it's a really, I call it a flagship because I think it really is a fantastic resource that we have here in Baines that works very well. So I'll take that away and make sure that we look at the messaging to make that clear, because the triage, it could be your GP, it could be the Community Wellbeing Hub. There are other front doors across Baines, so there's something for us about making sure we get the narrative right and communicate that is what I'm hearing, because it clearly isn't clear at the moment.
It might also be worth asking Healthwatch perhaps to come to this panel or to input and to see whether it is as straightforward as perhaps those in the business think it is. Kevin, have you done all 6 questions? I wasn't counting, to be honest. Okay, all right. Okay, this is everyone else's opportunity. Get in there quick. Liz.
I need to switch it on. At our last meeting, it was about dental access, and your report highlighted there were going to be new contracts for NHS primary care dental activities in areas of greatest need. Chair, by the way, is this okay to go back to this? Because I think this is a burning question for an awful lot of our residents. So there's going to be new contracts for NHS primary care dental activities in areas of greatest need, developing plans to commission dental services in areas where there is inequality in access, various other things. Bottom line is, will our residents see an improvement in access to NHS dentists? Because one of the things that I have read about is that the real problem is we are not paying our NHS dentists enough, which is why they are going into or adopting some sort of private practice. And I see this, the Integrated Care Board. I must admit, I do stumble over all these acronyms. Integrated Health Board, Integrated Care Board, has taken over commissioning in the southwest of dental services. And I do believe, I'm sorry to be political, that it is obviously something that the government controls with finance. So is there going to be a change? Are we going to pay our dentists more? Therefore, corollary is we're going to see more NHS dentists active in our area. Thanks. First question.
Have you got 6?
Yeah, so obviously I think, the issues that you set out are well rehearsed, and fundamentally they are structural issues that need to be worked through and looked at. So I don't have the answers today for you. We have put those questions back to our specialist team, and they are going to work through, because I think you had a number of questions from last time that, sorry, we haven't had answers to yet. Some of them it's because it's not timely, they haven't got the answer yet. But once they have, then we will of course come back. So I'm sorry, I don't have the answer for you today. I mean, clearly the intention is to improve access. What that will look like is what we need to work through the commissioning process.
And I think this might be something we might want to have a agenda item in the future on. And I know Jo was going to feed into that from attending.
Can I just pick that up a bit further, because of something that's happened to me recently. So we looked at the data at the last PDS, and clearly we saw that the numbers of adults who had NHS dentists had gone down. I had the experience of being an NHS, having an NHS dentist, going to the dentist, being told that because I hadn't been to the dentist within the last 2 years, I had lost my NHS dentist. I wrote to my dental practitioner as a counsellor and complained to them about what had taken place to me. And they weirdly, immediately put me back on the list with no problems, and my husband. One, that's great for me, and I did wonder if I should actually mention it in the beginning in terms of, anything to declare, because it seems really unfair to me that as a counsellor I've had a huge amount of savings. The cost of my checkup, which happened instantly, was £25, whereas if I had had to take part in their private dental practice, which was what they had expected me to, it was going to be £25 a month. So I haven't seen a dentist for 3 years. If I had had to pay that for 3 years and not seen a dentist, that's a huge amount of money to the average person and another adult in the family. I think we as an authority should write to all the dentists within Baines who are NHS dentists and actually ask them the direct question, how many people have gone off their register and what has taken place? Because I asked that question and they refused to answer it. It's a really serious matter.
Thank you, Jo. Your last point, I'm trying to work out who would be the appropriate person to raise that, and we might need to take that part away. And just checking with your first point about whether or not you ought to raise it as and I don't think it's a conflict of interest. I think our own experiences obviously influence how we approach a number of different items that we have before us. We are elected as sort of ordinary people in a way who would be expected to have ordinary experiences.
But clearly, the reason that I wrote as a counsellor made them say that I was back on the list, and that wouldn't have happened to the average person.
And that's a very good point. Laura, I don't know if there's anything you wanted to answer there.
I don't think there is anything I can answer to that, only just to note the data in the last report was very stark, wasn't it, in terms of the percentages. And yes, for adults going down, slight improvement for children, but still from a very low baseline, so a lot to do in that space.
And as I said, I think we will have dental services as a separate item. And I know we originally looked at it from a children's perspective, but we might want to have a think about some of those items like mental health that have crossover. Liz, do you have more questions?
Only two more. So thank you for that, and thank you for coming back to us about dental access and what's happening to the dental service. And I think what Jo's just said is very relevant, because this is what my residents and most of our residents are experiencing a situation like this. So it's good to bring relevant experience into this council chamber. And I would like maybe for us in the future to look at pharmacies as well as dental services, because the Integrated Care Board, I believe, is now in charge of the organisation of pharmacies, and maybe that's something Laurie could come back to us, because a number of them are closing down, and it's an alternative approach by the government that people should go to pharmacies and not bother doctors. So I think that is an important element we might look at. But going on back to kind of prescriptions, I just wanted to challenge you about why this service is stopping, this prescriptions ordering direct. Now, you're saying that only not that many people use it, but obviously it's an option for some residents to use this. It obviously must be fairly convenient. And the reason you said is that the level of financial support is not achievable. I looked up the website and there's nothing about finance there. So I just wondered, could you explain that? Because it does mean some residents won't have the choices that they should have had. And you talked about options. Is it just a WhatsApp that the options are going to be? Maybe there are more options. And then the last bit, and excuse me for my ignorance, but and I think it's about the bed situation and regarding discharge to assess, but I couldn't quite understand the wording. So it's working in partnership across health and social care. We are on track to deliver our plans to deliver against targets, including reducing the number of the non-criteria to reside in acutes, currently maintaining a position below our trajectory of 30, significantly reducing our number of discharge to assess beds by 40%. We're currently at 31, exceeding our target of 36. Now, I think you're reducing the number of assets, the number of people going back home and being assessed for their needs, that you're reducing that. But I'm afraid I couldn't understand some of the information.
Yeah, I apologise. That's quite an unwieldy paragraph, isn't it? I'll be more clear in future, so apologies for that paragraph. Do you want me to take that one first, perhaps? So, yeah, in terms of discharge to assess beds, as I was saying, one of the things that we're trying to do through the Home is Best programme is obviously promote that home is best and support people to be in their home as much as possible, so things like virtual wards, etc. Alongside that, therefore, what we're trying to do is reduce reliance on bedded care, so reduce the reliance that people are in bedded care while they await an assessment, a discharge to assess. And we know that we do that because clearly the prospects for people and the deterioration that could happen is not helpful for them and is not the best outcome for them. So that's why we are reducing our reliance on bedded care and looking at other alternative things like reablement and like speeding up Care Act assessments, etc. So the trajectory that we had, the target that we had to reach was to get to 36, and we've actually exceeded that. We're now down at 31, and I think that's coming down more. Overall, from where our current stock was, that's a reduction of about 40%. I'm looking at Judith, who's nodding, and relieved to see her nodding, because obviously this is work jointly across the team. So it is a formidable achievement. It's taken a lot of work to get to that. The trick in Baines will be, how do we maintain that? How do we do that sustainably? And how do we make sure then that the pressures that might put on other parts of the system, that we work through jointly together as well? So it's good that we're going into winter in this position, but we still mustn't keep our eye off the ball with the other challenges it might present. So that was that one. In terms of the prescription ordering direct service, so it was never intended to be a service that had to be provided. It was always a choice. And as I say, it was taken in 2017 at the time when we were looking at this. So to be clear, there's no decision that's been made that the service will stop, but we have put proposals forward to stop the current service in its current form and look at alternative options, because we can see that it does have unwarranted variation, so it doesn't cover across all of BSW. So whilst you say some people benefit, of course, by default, an awful lot don't. So actually, in particular in Baines, we only have one practice that benefits at the moment, out of the numbers that I was quoting. The financial position is that the cost of that pod is currently around £2 million. So it is clearly not something that is sustainable moving forward. And given that the context has changed, so in 2017 we didn't have things like the NHS app, and we didn't have the repeat prescription approaches that we now have the opportunity with our community pharmacists, as we were saying. And we know from those practices that don't have pod in place that they have been able to manage it internally in a different way So therefore, this is our opportunity to look at that, really. So no decision has been made at the moment, but it, of course, would be remiss, given the current context, not to look at that properly and thoroughly.
Did you have any more questions, Liz? Was that? Okay. Other questions? I know that there's been some other questions that we've considered in the past, which might be more appropriate to put to the chair of the ICB. So it might be worth us considering inviting her to come at some point, if that meets the approval of everyone on the panel. Also, it's always nice to meet people in person, isn't it? Yes. Okay. Right. Thank you. I'm going to move on to the next item, unless anyone's got any further questions for Laura. Okay. So the next item, item 10, is the Adult Social Care Transformation Update. I will invite you to speak in a moment, Alison, but I just wondered, this what's before us now is not in it what we would expect it to receive as a report. So it would be useful, I think, in future if we had a report that really clarified, in the same way we asked for Laura, to have, what are we being asked? Is it merely to note that where we are now, or is it, are we being asked something, to sort of determine, a path forward? Because, and it also means that we might spend longer perhaps on examining what is before us, because we don't have all the information in front of us as well. So it's just something for you to take away for future reference. Are there any other comments people want to make before we ask Alison to go through these slides? But thank you for showing the slides with us. Right. Over to you then, Alison, as the Cabinet Member.
Okay, sorry, thank you. Yeah, I think it might be helpful in future in terms of agenda setting if there's more clarity about what is wanted, and then we can make sure that we are providing what's wanted. I understood that this was an update on the adult social care transfer, which is what I think this presentation provides. But I'm going to hand over to Claire to take you through it, because she's the lead on this, and she has put the slide pack together, and I think you will get a more thorough presentation from her, but I'm very happy to take any questions at the end. And obviously, if there are things that are not covered, if you can identify what they are, then I will understand more what's needed in future.
Thank you, Alison. Claire?
Can I just test that I'm not making an echo? No. Wonderful. I'll stay put in this seat.
But you might want to move your
of course.
Laptop.
Okay, so I'm starting on page 22 in your slide deck for panel. If you recall, we set up in Baines 3 programmes in terms of the community services transformation. Programme 1 is dedicated to adult social care transfer, and that's the services transferring back to the council as of the 1st of April 2024. Programme 2 is in relation to the public health services, and Programme 3 is in relation to community children's and health services. And of course we have from the Integrated Care Board, Laura Ambler here today in terms of what's happening with our health colleagues. I'd set out that just to, by way of a reminder for us all, the complexity of the change programme that we are going through in Baines, in addition to the health service landscape of BSW. But today, the update was centring on Programme 1 and the workstream in particular for adult social care transfer. If I move you on to slide on page 22, that is an overview of the teams that will be transferring back to Baines Council on the 1st of April 2024. So we took the key Cabinet decision on the 10th of November 2022, and it was thereafter that we set up these programmes of work. At present, It's 240 individuals are estimated working on those teams. We don't have individual names yet, I will come on to that, but we do have top level transfer information of the volume of staff and workforce that works with each of those teams. What I've done there to break it down, so as we're not in the role of talking in acronyms, is giving some detail of the two elements here. So we're talking about adult social care, that's the social worker team. We're also talking about the direct payment service, and that's a small team of individuals that work in with the adult social care worker team, but we're also talking about a provider service, and that is for adults with learning disabilities and their family service, and that's a provider service that's delivered in Baines in 2 locations, which is Connections and Carswood. As you can see there, we've quoted at the moment the 240. What I'll come on to later is what that means in terms of management of vacancies in the meantime. So where we're at in terms of milestones at present, mid-October already, of course we're aiming, the landing is a hard date of the 1st of April 2024, so we're still 5 months out of this transfer programme. So the update today to panel is in light of recognition of where we're at currently within the transfer and the programme of work. What I wanted to enable today is to give panel a level of assurance of how we are working on the adult social care transfer. What we have done is set up a number of work streams, and I will take you through governance in a moment, but those enabling work streams, as I refer to them, actually demonstrate, as well as myself and Anne as the Assistant Director for Operations, where these services and teams will land, is how we've had to bring together a number of corporate colleagues to actually ensure the safe transfer and make sure there's lots and lots of due diligence that's underway. Those range from HR and operations, as you can imagine, in dealing with a transfer of individuals. HR takes a prominent role in making sure we're doing that diligently, alongside IT, systems, estates, facilities, health and safety and wellbeing, our legal team, finance and procurement, communications and engagement, and how we look at any operational redesign. So I wanted to give panel an overview of the level of staff and sort of project management as well as officer input going into making sure that we are diligently approaching the adult social care transfer. I'm now on slide 25, which talks about governance and assurance. And this is programme governance and assurance outside of sort of panel and key cabinet decision governance and assurance. What we have done, like other programmes and like our integrated care board colleagues, is set up a programme board. We meet on a 6-weekly basis, and that programme board is chaired by the director, and in the director's absence has been chaired by Natalia, my colleague, as another assistant director. And that board is fed by all the work streams, the cross-organisational governance work that we undertake with HCRG Care Group. We meet on a monthly basis, and the work stream-wide meetings where we're actually dedicated to the milestones and the ratings of achievements that we need to make by set times. In terms of assurance activity, I brief my lead member, Councillor Bourne, on a monthly basis, both in a written briefing and by way of a lead member verbal update in a meeting environment. I meet monthly with trade union representation. There are risk registers, as you would expect for a programme of this complexity, that are continually reviewed, and I also do review sessions with the lead member on that, as well as review sessions in light of the interdependencies of the other change programmes that are occurring both this year and next. As programme lead, of course, you would have expected me to have to go through council decision-making process. So only last week I spent 45-minute session with informal cabinet. That was wider than just the adult social care transfer, but spoke in the main across the whole of community services transformation. And of course I go through to senior leadership and corporate management team meetings by way of providing regular updates. There are slides dedicated to the internal audit that took place. That was over the summer period from July until September, and we also have each work stream completes a highlight report that talks about project milestones, achievements, risk, emerging issues, and as you can see, for transparency today, making sure that all of the programme teams and the project updates come together to actually review those, because even within our corporate enabling functions, there are many, many interdependencies. Taking note from questions that have come from panel previously and learning from previous transformation and transfer programmes, we have set up a number of briefings with HCRG care group staff, specifically the workforce that will be transferring back to the council. We have held those sessions as team-based. We've gone out to their locations of work. It's a wonderful opportunity to meet the team and make sure that we are answering their immediate questions, and it's an opportunity for them to fact-find as well, outside of the formality, if you like, of going through a transfer. And it's an opportunity for them to raise questions about in relation to what it means for them as individuals, as professional workforce, alongside making sure that we're able to talk about the service users and the residents of Baines, and how we can ensure that safe transfer. I must say, HCRG Care Group senior leadership team have been wholly supportive of all of these sessions, and we deliver them as a collaboration. And myself, Teresa, and a number of other individuals, especially from our HR and operations team, attend those sessions. In the main, they have concentrated, as we would expect, on people's individual questions around what does this mean for myself, terms and conditions, what can I expect to happen. We have gone through detailed updates from HR of the transfer of undertaking of protection of employment, the TUPE rights, and we're making sure that we are able to give, given where we're at 5 months out of the transfer, as much information as we are able to. Now, we did the last sessions only last week, the week before, and we split them between the provider services as well as the adult social care teams, and we are going out to meet those teams again in November, and we have additional sessions planned for the new year. So please, panel, feel assured that we are making sure that we are visible as council officers to support the workforce to go through this process. I'm going to move on now to slide 26. That talks about some of the key milestones that the programme has reached to date. As alluded to, the majority of the diligence work has been with regards to HR information and receiving the first level of high-level information back from HCRG Care Group on the configurations of those staff teams. The reason why that has been absolutely crucial to hit that first milestone is that has enabled our IT and systems colleagues to do what we refer to as the payroll build. So as alongside, it's like a dual carriageway, isn't it, of making sure we have safe landing to ensure the safe continuation of services for Baines residents that benefit and use them. We also want to make sure we have a safe landing for the workforce. So there's lots of HR and lots of IT interface at the moment. Next phase is estates provider facilities to make sure that we are able to provide clarity come November to the individuals that are transferring about some of the changes, and we refer to them as changes, but in formal HR language, that is the measures letter that will inform the staff and formal consultation that those individuals go through, but that is not yet planned until the end of November. But I wanted to give panel assurance that it has been fully thought through and lots of diligence gone into that approach. We Also wanted to make note, as well as making sure we do that detailed briefings with the HCRG staff group that will be transferring, it is also cognizant of us to make sure our communication engagement plan does not miss out our own directorate and our own workforce as well, because of course the directorate will be receiving in a substantial number of individuals that run services, and of course we are adding to our provider services function. So we are also undertaking those briefing sessions with dedicated adult social care staff. What we do through our usual staff management meetings and extended meetings and huddles is make sure that I give relevant and pertinent updates to the adult social care transfer as we go through each month. In terms of next steps, Anne and I are going back to visit our senior leadership team at the early stages of November, and of course, as you would expect, that will have a heavy emphasis on cost to date of what the project has spent and what we refer to as the mobilisation, and what the continuation of that looks like until the point of transfer on the 1st of April, and of course the setting of the operational budget for the delivery of the service as of the 1st of April 2024. Meantime, what is absolutely pertinent in driving our conversations at the moment as well is around estates, i.e. where will those individual teams be based, and making sure that we're giving due diligence to not losing any of the integrated pathway working where these teams have had access to health colleagues in the future. So our estates planning is, yes, of course, about a physical location, but it's also about enabling those ways of working so as we continue to work in collaboration across our health and social care integrated system. And of course, we're making reference to CQC registrations, and I'm starting the work on the business transfer agreement also. So I hope you feel assured there's a huge amount of work underway to ensure the transfer runs as smoothly as we can. Rather than just take my word for it, I wanted to update panel on some of the high-level feedback from our internal audit. The report was only finalised last week. As you can see, it has achieved level 4, which I am pleased with, and I think that's a testament to the dedication of all the individuals, both within adult social care and corporate colleagues that are taking the lead on this programme. Level 4 refers to substantial assurance. Level 5 would have been full assurance, but we did have 3 or 4 minor recommendations, which is why we achieved a level 4. As you will see from the outcome of the control measures and the objectives that the audit team wanted to test, we achieved good in all of those areas. Moving on to slide 30. I won't take you through them in verbatim, but I wanted to highlight there that the outcome of the audit in terms of a conclusion referred to the robustness and the comprehension of the programme governance, the way that we track the milestones and highlight risk and manage the programme through to decision making. And of course what it referred to is an example of programme management excellence by way of the adult social care team learning and making reference to lessons learnt from the transfer from Serona to back through to the Council of the CRCs, and more recently from HCRG Care Group, the safeguarding team. I wanted to update panel in terms of governance and next steps. So in a moment I will hand over to Laura, who will talk panel through the 1-year direct award from the Integrated Care Board's perspective and give an update on where we're at with that. But of course, we are going back to Cabinet on the 9th of November, so in a handful of weeks, and that Cabinet report will give an update of the adult social care transfer in the way that I have done today. But more importantly, what that November Cabinet paper will do will also be the opportunity for Cabinet to take decisions on the future operating model for the future commissioning of community partners and of public health services, and that will be as of April 2025. And of course, it will be following the single member decision that was taken back in July, a further endorsement of BAME's officers working with our Integrated Care Board colleagues on the procurement process that the Integrated Care Board is about to embark on for securing children's and adults' health services as of April 2025. Given that, Chair, my proposal would be to panel to come back to panel at a later date, whereby we can give the full update right across the whole of community services transformation, because I am very aware today this is an update on the adult social care element of the programme, but of course there are considerations for community partners, public health, as well as the future plans for health services across BSW and specifically the Baines locality. So that was my update, and I was going to hand over for the final 2 slides to Laura, who will talk you through the 1-year direct award.
Thank you, and I will save my questions for you for after Laura.
Thank you, Chair. Again, just to pull out the salient points on the next 2 slides. So, following the single member decision implemented in July, to endorse the proposal for an interim 1-year arrangement for the commissioning of community services contract. And if you remember, that was to make sure that we were able to maintain effective delivery of services whilst we looked at what that transformation programme 3 would look like. We've made some really good progress. So we know that the Services Commission will be delivered within the approved policy and budget framework as it currently is now, and the decisions that were taken in July. The 1-year director award involves all of the funding streams that originally contributed there, and they're listed on the slide, and it doesn't affect the transfer that Claire's just been speaking about. There is, in the 9th of November report to Cabinet, a potential for a decision on any residual funding risk that there is, but I have to say at the moment we are working through that with all partners involved, so it may be that that funding liability materialises, or it may be that it doesn't, or that it's relatively modest compared to the full contract. When we look at the contracting process for that direct award then, the only change really, I guess, is that the ICB is the coordinating commissioner, but Baines Council remain as a co-commissioner. So we were co-commissioners before, with Baines taking more of a lead, and now it's the ICB in that instance. That means the ICB have been leading that contract negotiation with HCRG Care Group, and we've also been doing that with our Wiltshire colleagues as well. The progress that's been made, as I said, was really good. We've already agreed the Community Services Commissioning intentions, no variations to the local quality schedule, and standard contract terms to roll over. We are awaiting confirmation on what the final format of the contract will look like. That's more a practicality, partly because we need to see what the standard contract format is, and we also just need to think about how we do that jointly across Baines and Wiltshire. So if it will be one contract with 2 schedules, or whether they will be separate, remains to be seen. And we'll continue to work forward through governance and monitoring arrangements so that we have those appropriately and robustly in place, as you would expect. So I think that's it from me, Claire, and if there was anything you wanted to add. Okay.
So I'm just going to ask one question first of all, which is, it's about the role of scrutiny. So if you are going to bring a report back after the Cabinet decision has been taken, will you have a think about what you expect this panel to do? Because if it's merely to note, then obviously that's what we will do. But if there's an expectation that we will somehow be involved in a decision, you might want to consider whether bringing a report after a decision has been made is as useful as you might think. Okay, thank you. Right, any questions on what we've heard? It's been a lot of information, so again, that would have been quite useful and great that it was on the slides, but I think perhaps some sort of summary in a report could have been useful as well. Thank you very much. Jo.
Hi, thank you very much for your update. That's really useful to hear. And it's interesting to hear about how the present staff fitting in is as important as the people you're going to have to look after, and that is key. I guess a lot of those people are... How many of them actually belong to trade unions? And how have the trade unions worked with you on this process?
That is a great question, and I don't know. I would need to go back and find out from HCRG Care Group if they have information on those current workforce involved with the trade unions. And of course, I can do that through our leader trade union representation. We meet on a monthly basis with the trade unions. That's supported by the HR partner that's been dedicated to this programme, and of course it is full representation from a range of trade union individuals, and rightly so, they want assurance, don't they, about how we are making sure, isn't it, and making it available that we go through. So we do have lots of challenge and dialogue around those key messages and those milestones about engagement with those individuals. Councillor Wright, I think it's fair to say that come the November briefing that we have with HCRG Care Group Workforce, that's when that role is going to be even more pertinent, because that is then going to trigger the approach to the formal consultation that those individuals are then experiencing.
Okay, all right. And then following up from that, I recognise too that this new workforce, we are the Avon Pension Fund in Baines. How will they sit in and fit into that pension fund?
Mm-hmm. We are working diligently through that. HR and myself, Anne and colleagues from Avon Pension Fund are working through the due diligence as it stands, because of course individuals will come from a range of pension opportunities, and that is absolutely the focus of our November briefing with those individuals, about that advice on approach and what we can do to support them, because we want them to make good decisions for themselves, don't we? And it needs to be an informed decision, and it's a terribly complex landscape understanding pension liability, isn't it? So we're bringing in the experts for the November briefing.
And then going back to Avon Pension Fund, so clearly as a pension fund we need to invest well. It's an organisation that is now coming in-house, but how could Avon Pension Fund be asked to use its investments to support what should really be a business that is now not going to be out of house but in-house, but there is lots of money in this process. So again, you know, I am clearly being political here. Divestment from pensions funds is important at this process, but equally where we spend our money now to make sure it's being spent well in the public care sector is important. So how are you working with the pension funds to make sure that the right investment can come from them?
That is an excellent point, and I understand fully the rationale and the need to ask that question. I'm not in a position today to make an immediate response. Can I ask, Chair, that is something we take away and that comes back, because that would need to be led corporately with feedback from Avon and pension officers. Thank you.
Thank you. Was that all your questions, Jo? Okay. Liz?
Thank you, Claire. I mean, it looks like you're working hard to have a smooth transition from HCRG to Baines, and obviously we would hope that the trade unions have been involved at various processes with your human resources, etc., and your 2P arrangements. But I do wonder about, I mean, firstly, can I just say, there are those of us who are absolutely delighted that HCRG is now, our adult social care services are now being brought back in-house, and that's a really good thing. I would hope that the financial implications would mean that it will cost less to the council, but it would be good when you come back to have some sort of advice or a report as to what the financial implications are, and that hopefully we will see a saving because it's now in-house rather than commissioned out to an external service. But I'd also, so that's one thing. But the other thing I'd like to ask you, Helen, is why are we, I think we discussed this at our last meeting, but why are we involving HCRG for another year from 2024 and 2025? Why are we not going for a clean break?
Yeah, as I was saying in the update, we need to maintain the current service safely, so there just simply would not be the time to do that break and go through a full procurement process. And also you'd miss the opportunity of looking at the broader transformation. By doing it this way, it affords us the opportunity to do both. So I think, it's worked out that it will give us more time to then be able to look at the transformation moving forward. And again, just to echo where Claire was saying, HCRG have worked with us very professionally and collaboratively in doing this direct award, which obviously has been very welcomed. And so that has helped us maintain the service delivery, which is paramount, really. Patient quality and safety has to come first.
If the Cabinet member wants some input here. Alison?
Yeah, can I just add to that? If you remember, when we made the original decision to extend the HCRG contract, one of the reasons we did that was because we were aware of all the changes that were going on in the NHS, plus the challenges they've been through COVID, etc. And it seemed to offer continuity at a time that there was an enormous amount of change. Then obviously things changed when Virgin Care was sold, and we reviewed that decision. But whereas the Council has been able to bring the services safely back in-house, or should be able to bring them safely back in-house by next April, I think because of everything that was going on in the NHS, it became clear that that was going to be extremely challenging, which was why you took the decision to have another contract for the healthcare element for a year, just to buy a little bit more time. And we felt that was reasonable, which was why we supported it.
No more questions? No? Any other questions? Kevin?
Great, excuse me. Great to see the level 4 assurance and things, thank you. What do you see as your key challenges now?
I nearly forgot my microphone then, apologies. I think key challenges are, it's a volume of staff, isn't it? It's a significant volume of staff that are actually going to grow the adult social care directorate quite significantly. It will grow the workforce of Baines Council quite significantly. Thank goodness we have 2 recent transfers to learn lessons from, which is why I have this project manager, Teresa, cleverly supporting this programme that was instrumental in those previous transfers. Therefore, I think given the current ambition of adult social care in Baines, and you will hear some of that in the next presentation when we give the feedback from peer review, it will be about making sure that that workforce is transferred safely, but of course recognising there will also be a period of cultural readjustment for a workforce that has actually been with another provider for 7 years, in line with the future ambition of adult social care and how we want to move the way we deliver our services in the future. So for me, that's going to be, the challenges are twofold, threefold if you add in the finance challenge, which of course I agree needs to come back in future detail, of making sure safe continuity of services, transfer of a workforce, and an understanding that at the point of transfer on the 1st of April 2024, our work is not done. In many ways, our work is just beginning, isn't it, to make sure that we're delivering the services in the way that we want to as Baines Council, and doing it within a within the financial budget, and doing it effectively.
And will they transfer the staff on at least good terms or better terms?
Yes, so the staff will be transferred on their existing terms and conditions over to Baines Council, and then we will undertake, as part of that change programme, a re-evaluation and a review of those services once they've actually returned to Baines Council.
I believe that was only 2 questions, Kevin. Losing a touch. Okay, any other questions on this presentation? Thank you. I don't believe we were asked to do more. Well, we certainly haven't been asked. It hasn't been implied that we've been asked to do more than to note. So I believe we have duly noted. You may.
Sorry, just to go back to your internal audit, you said that it was an internal audit. I guess what the wider question is, do you think there should be an external audit at this point?
That was going to be something I was going to raise when I go back and have feedback with the corporate team. So I think it's a fair challenge, it's the right challenge, and I will take advice from our corporate director for those services and ask that very question and come back to panel.
Thank you. And thank you, Claire, and Laura, for presenting that. Okay, we're now moving on to item 11, which is the peer review that you also referred to. Can I say two things on this before you start? One is, again, it's the same point that we've made in the previous items. If this is a report, it should be a report. A presentation is great, but what do we do with this? So that's the first question. And then my second question is about, and hopefully you'll pick this up in your presentation, is why it was that Scrutiny wasn't involved in this peer review. It seems to me that is slightly unusual, so it'd be useful to get your thoughts on that. So Alison, I believe you're introducing that, but I assume by the nods that Claire's going to be taking it on. Anne is going to take it on from there, but Claire was nodding on your behalf, Anne. So, Alison.
Okay, yeah, I'll just introduce this and then I'll hand over to Anne, who's going to go through the presentation. And she will also answer the question about why scrutiny was or was not included in the peer review. Just to give a bit of background, I'm sure you're all aware that councils are going to start to be inspected by the CQC in a similar way to children's services are inspected by Ofsted, looking at adult social care services. That starts, I think, in January they're doing the first ones. I think that's the current timetable. And they have been trialling the inspection in a few areas. And we obviously need to get ourselves ready for that. And we took the decision that one way of getting ourselves ready would be to have a peer review so that we had an external group of people who came in, who understand what the CQC inspection regime is going to be, and who would look at our services to help us understand what it is we're doing okay and what we need to do differently and where any gaps are. So we had that inspection in September. We had the headline report very soon after that, and I think we've just received the comprehensive report, which will be published. But at the time of the papers going out, we didn't have any of that, so we had to give something a bit more brief and headliney, but it will very soon be in the public domain, and I'll hand over to Anne there. Thanks.
Thank you, Councillor Bowen. And Chair, just to pick up on that first question that you asked, as Councillor Bowen said, this was to give panel advanced information before the full report is available to you and to the public, and also to allow any further questions or any requests of ourselves in terms of information that this panel might want to see in more detail, both from this presentation and following the publication of the full report. So apologies, as Alison said, the full report was not available for this panel. It has become available this week. And I'll pick up your second question if you don't mind, as I take you through the first slide in terms of the peer challenge. So peer challenges are undertaken by the Local Government Association. They're a challenge that a local authority does pay for, and it is a challenge that many local authorities are going through at the moment, as Councillor Bowen said, in preparation for Care Quality Commission inspection of adult social services. Those inspections are quite similar to inspections that take place in terms of things like care homes or care agencies, but with a focus on the delivery of adult social care, adult social work, commissioning of adult social care services, and there's a little bit of more information about that side. So you will be familiar with Ofsted, and I always equate it to not dissimilar to Ofsted for children's services. So there is a process that the Local Government Association uses, and there is a set format for that, and there's a set list of evidence that they require. There's also quite a set timetable in who they expect to see and who they ask to speak to. So scrutiny panels, health and wellbeing boards or cabinets are not part of what the Local Government Association generally asks to see. They usually ask to see the lead member, but also ask to see officers of council for delivery. We are mindful that there are ways that which panel scrutiny and other forums could feed into the peer review, and that's something we will take away and perhaps pick up on, because we did a lot of work on producing our self-assessment, and perhaps something that I hadn't equated was to actually ask this panel to have a look at our self-assessment and for comment. So certainly reflected on that, and we'll look at our update of the self-assessment in line with that. One of the things that the peer review said to us in feedback as well is that CQC will expect to see many more frontline staff. They're not particularly interested in talking to managers. They want to hear what the frontline delivery is, and they want to see many more service users and people who receive services. But we got very good positive feedback, which I'll come on to, about the engagement of our adult social care workforce. So the first couple of slides takes you through the process of the peer review, who was part of the peer review team, the pre-work that we did, the number of people who the peer review team saw, and how many hours they spent actually reading all of the evidence that we'd provided to them. And pre them coming to see us on site, they spent 2.5 days at Keynsham Civic Centre. 2 members of the peer review team came and looked at our adult social care case files, so how we do assessments, what we write about individuals and how we're supporting them. In terms of the key messages and strengths overall as a council, because they did look at adult social care in context of the whole council and of the whole system as well. Strength in terms of how the organisation is led, clear political purpose and corporate purpose, and how that fed through into what we were intending to, and also currently delivering adult social care. The way that staff from all areas of the council, partners and our providers approach this in terms of being very person-centred, being really, really clear about what our purpose is. So that led on to, very self-aware in terms of our self-assessment, but also in how we talked to people, and strong partnerships and relationships. Again, considerations, just about how we use all of those things that we have, our tools, resources, our data, to deliver the best services for our population. We're very ambitious, so I suppose my summary is be careful about your ambition, because you have a lot to deliver in 6 months and beyond. So, and then thinking about as well in terms of some of those strategies, the corporate strategies that might support adult social care, things like digital strategies, our customer-facing offers like Council Connect and Community Wellbeing Hub, and how they can be used to further enhance the offer for our residents. As I say, slide 5 is around, and the further slides are the themes that the Care Quality Commission look at, CQC inspection. So the peer review uses the same themes, and we've used the same themes to talk about ourselves. And again, I won't read it word for word, you can read through this. But again, our strengths and the feedback that we got from the people who received services was very strong, and from the frontline staff. They were They're called the Community Wellbeing Hub and our Live Well offer exceptional, and that's a lovely thing to hear from the peer review, and certain members of the peer review team asked for more information. They felt we had a real strength with our third sector colleagues and our third sector providers, and strong commitment, like I say, across everybody who works to deliver adult social care around the person, around our residents being centre of that. And then, as I said, considerations about developing some of our strategies, developing some of our information advice. Very interesting, Councillor Wright, that it came up in the peer review in terms of how we offer or get people the right financial advice, because we have a lot of self-funders in Baines, so making sure that people have access to all of the benefits that they're entitled to, and how we make sure that we understand that self-funders sometimes do run out of funding, and how we support them early. So that did come up as an area for us to consider to grow as well. Providing support, again, lots of positives about our commissioning colleagues, our integrated working, great examples of direct intervention, true collaboration, lots of positives about our Home is Best programme, and again, considerations around equipment, prevention, technology, so all things that this panel often talks about. And continuing to work with our providers to get, the best provision possible within Baines, as opposed to us needing to go outside. Our safeguarding offer, again, was seen as a strength, as was the partnership and the way that we have the partnership between children's, adults and community safety in Baines. And again, some considerations about that board, that community safety partnership board, that collaboration could be stronger, could drive more change, and to bring some co-production into that work. When they looked at individual cases, what had happened for individuals who'd perhaps had contact with adult social care, receiving services from adult social care, again, very positive about how we engage with people, how we talk about people, how we look to people's strengths. And again, not dissimilar to what this panel has said, the use of acronyms and jargon in our case note recording is something that we've taken on board. But also to make sure that when we do work with carers, unpaid carers, that we actually record that we're actually clear about the offer that we've made to unpaid carers as well. And then leadership, again, pleased at the outcome of the peer review in terms of visible leadership. Goes to what Claire was saying in terms of not just for our own staff at the moment, but we are out, we are engaging with HCRG, we are engaging with our partners, and leadership across all levels and all parts of the department and the council. And then, again, feeding in, and we are using this to inform as the services transfer across to the council, how we bring those things together and deliver to the residents of Baines, how we look again to strengths of those individuals, and how we have some consistency in our offer to individuals right from that advice and information part. So finally, our next steps. So as we've said, we received the final report this morning. It's all been sense checked. So we will just work through the process for publication for that. We are briefing and holding sessions with staff around the outcome of the peer review. Firstly, there is a thank you to everybody who contributed, but also that staff know, well, what next? This isn't a this isn't a single process, it continues. Considering that in the context, as I've said, in terms of the transfer of services, We will also update our self-assessment. So as I said, we've reflected on that, Chair, in terms of how this panel could have contributed to that. We will update that, and alongside the report we will look to publish our self-assessment as well. And we continue to learn from other councils around preparation for CQC coming and inspecting us. We've appointed a quality assurance lead who will work with Claire in Claire's service, who will keep the work going that a gentleman called John Goodwin's been doing for us on an interim basis until Christmas. So we're bringing that person in because we will continue, as I say, this is a continuous process for us. Thank you.
Thank you very much. I'm sorry, I'm going to go back to this question about the input from PDS. So my experience as somebody who's been a councillor for a long time and been involved in Scrutiny for a long time as a cabinet member, but also as on a peer review team too. Actually, Scrutiny is invariably involved. So I just, put that challenge back to you and perhaps suggest in future that Scrutiny should be involved. If we're a critical friend within decision making, I would imagine our input ought to be being sought, actively sought. So, panel, any questions on this, on the peer review? David.
Thank you for a lot of work. I've got one question regarding page 43 of the slide deck. With respect to carers, records review did not evidence a robust approach to supporting carers. I just wondered if you could expand a little bit on that, because it was only 6 case notes, and for them to come up and then say that worries me.
You're absolutely correct. Where we looked at those individual records, and what we found with a number of case notes is because we have our offer from the Carers Centre, what social workers will often do is they will offer us a carers assessment. They absolutely should do that. They will record that they've offered a carers assessment and refer to the Carers Centre. But then the outcome of that and what happens there isn't necessarily recorded on our case notes. So that's where we've got the gap. In terms of making sure that we update our case notes in what's happened for that carer.
Thank you. So you think it's a documentation issue rather than a practice issue?
I think it's a documentation issue, yes.
Thank you.
I'd like to back up what our chair just said. In the past, peer reviews have always included all aspects of the council. And it's very important that when you get a peer review, which is LGA-led, that you do pick up all those different voices that we have within a council. So that's just not the administration, it's the backbenchers of the administration plus the opposition parties. And that's always been the case in the past. So what I would like to strongly urge Alison to take back to Cabinet is that future peer reviews should not be held in secret away from the PDS, but should include the PDS and should include the opposition parties as well, so that we get a fully balanced and rounded view of all the issues that we face as a council. And it's by getting that fully balanced and rounded view that we often in this council reach consensus across difficult subjects, and that is important going forward. So I would like to challenge you much more strongly than Dina said. In future, Scrutiny must be involved in PDS. It's always been that case in the past, so this is a new departure, and I don't think it's a welcome departure, so I think that needs to be revised and considered and reflected upon.
I'm happy to take that back. I haven't been involved in a peer review before, and I was kind of led by what we were asked for, but I do think it's a very reasonable point, and happy to feed it back and ensure that it's considered for any future.
Feel free to use Paul's much stronger argument. Thank you. Kevin.
Yep, thank you very much. Alison, I apologise because I didn't get the right information. So my question really is based around your report initially, on which mentioned the peer review. And it sounded from what you wrote as well as overall it sounded quite positive, which was great. Were those results, or the results of the outcome, what you were expecting? And were there any surprises, either good or bad? And finally, do you feel you are where you want to be, ready for the inspection?
I'll go first and then Anne can add some more. I think one of the comments in the peer review was that they felt that we were a very self-aware service and that there weren't surprises. So I think that probably was our experience of it as well. I don't think they came up with many things or any things really that blindsided us that we weren't expecting, which was obviously reassuring. In terms of our readiness for the real thing, I mean, I think this has helped and it has given us some assurances, and it's also given us some confirmation of some of the areas that we do need to be making further progress on. I think we're probably in a reasonably good position, but also, you know, you don't know until you have it. So I wouldn't say we're complacent in any way, but we continue to working on it, and the fact that we're keeping we brought someone in to do some work for us on the preparation, or with us on the preparation. We're keeping him. He's done a very good job. We're keeping him until December, and then we've got this new person who will be in-house and working on the quality. So yeah, I think we're reasonably well prepared. But that doesn't mean it'll be plain sailing.
Is this your follow-up question?
Just a quick follow-up question. So what is the areas that you are going to tackle first, based on the report?
I think I'll hand that one over to Anne.
Thank you. So on the being prepared, what I would just ask is, and anybody, like I say, you'll be familiar with Ofsted, is that we've always got to be ready for inspection. If you chase inspection readiness, we're doing it the wrong way around. So we've taken that learning away, and we've also taken learning from one of the peer reviewers who's just done one of the first CQC inspections. She's been a pilot area, so she gave us lots and lots of good tips around that. In terms then of what we need to manage first is that in bringing, and lots of things are linked to the transfer, in bringing staff groups together to work as a single service for our residents, one of the key things that was highlighted from a practice perspective, from a social work perspective, is we need to refresh our quality of practice, our frameworks around that, picking up the point around making sure that when we do look at individual cases that we know what's happened for people. So that's one of our priorities which we're working on now in terms of the practice framework and support for staff as well. There are some other things to work on which they've highlighted again, which are all things that we are working on, such as, and Natalia may want to say something about the carer strategy, so that's the piece of work in train, but also that strength of that, what we just talked about in terms of that front door, when you first contact the council, getting the right advice and information, not just about adult social care, but everything else that we offer as a council as well. There are three priorities, I would say, as well as keeping the consistency of the self-assessment and the assurance work going.
Thank you. Any questions before I come to Liz?
Okay, many thanks. Firstly, I would endorse what's been said about greater involvement of our PDS panel in the peer review, and I think that's been taken on board. I would like to challenge and perhaps get more information about the fact you just used 6 cases. Do you think that's statistically relevant? I mean, you got a variety of responses, obviously, but should you have used more cases rather than 6?
So we would always like the peer reviewers to look at more cases. That number was determined by the peer review team, so they only allocate 1 day for one of the peer review team to look at cases. They'd come with the intention of looking at 15 people, but to do justice to all the work that happens, they only managed to look at 6. I agree we should look at more, but that's the time they had.
That's it. But I do think there probably was enough in the 6, but I would say probably would have been better to have a few more cases. Just one more question, if that's okay, Chair. One of your key messages in your strengths and considerations, and there was a really nice term there called ambitious plans. Now, where I come from, ambitious plans mean that they are not achievable. And I think Alison mentioned this as well. So I like the term. It means you're aiming high, but you may not get there. Do you want to add a bit to that?
I don't disagree with that at all in terms of how that was fed back to us. So when they talk to us about, we do have ambitious plans in adult social care, and you can see that through our business plans and everything. And one of the things that the peer review team did say back to us, you have very ambitious plans. Make sure that, which is, I think, is your point, that they are deliverable, achievable, but also it was back to it is not adult social care alone in our plans, so back to that corporate offer as well, and our partners. So that was fed back to us.
Thank you. Any more questions? No. Well, thank you very much for bringing us that report. We now move on to item 12, which is the care force in Bain's paper. And before we start, I'd like to say thank you very much. This is the sort of report that we like to see in this particular format. So thank you, Judith, for your work on this. I also would like to say that it says in the report that we are to note this report, but usually, if there are questions, then I would suggest that there might be more than merely adding in a point for us merely to note it, because then we would it could be seen then as a sort of rubber stamping exercise, but I think you will want to have more feedback from us than merely noting it. So as we have the report before us, and I would hope that you would assume that we have read it, is there anything else you want to add to this report, or any points that you want to draw out for our attention? Sorry, Alison, but I'm assuming you're passing to Judith.
Yes, I wasn't sure if you were asking me or Judith. We were asked for a briefing, I think, on adult social care workforce, and Judith and her colleagues have produced a really, really comprehensive report, which I think should enable you to have a fairly thorough understanding of what all the issues are and where we are in relation to it. But I'll hand over to Judith in case there are any areas that she wants to highlight before she takes questions, or we take questions.
I'm happy to take questions. I'm hoping that I've given you a fairly wide discourse and being able to give you an understanding of how that's directly impacting the services that we run, as well as those that we commission. So I'm happy to take questions on where you might want to explore this.
Thank you very much, Judith. Michelle.
Thank you, Judith, for the report. So the two things that jumped out of me in the report, the first one was an older workforce, which obviously isn't sustainable long term. And the second is, and they're kind of linked, and the second is about the sort of lower uptake of qualifications. And I was wondering if we could do a piece of work around, how do we attract younger people to the profession? And actually, a lot of that is down to giving it a higher status and making it a real profession, on a par with nursing or any, other healthcare kind of roles. And I was wondering if we could do a piece of work on that. And obviously that's linked to things like, better pay and conditions, which was mentioned earlier on in the meeting. And I think actually, for us as a council, we've got a real opportunity to show some leadership here, and show other councils how this should be done, and making sure that our care workforce is well established and sustainable long term. So I think it's probably not a discussion for now, but I think that would be a focus I'd like to see in future meetings, if that's possible.
Yeah.
Thank you.
I think that's a really helpful point you raise, and the work that we've done with United Care Baines, which has been the service that Anne was talking about earlier, the combination of the council working alongside the IUH, both anchor institutions, I think has been really important in this respect. When we set that up, we made a few caveats about the way we'd do that. First of all, we wouldn't recruit from the existing workforce of care, and that we would look to setting up pay and terms and conditions that were equivalent to what we would expect within the council and within the RUH. We also use the RUH on the basis that, as you say, they're understood to be an organisation that people want to work for as nurses, etc. And that has worked for us really well. And we work very closely with our provider organisations, who I have to say in the first instance were somewhat doubtful as to whether creating a council-led service was the right thing to do. They saw it as competition. They still have their doubts. I'm not going to say that it's all completely gone, but what it really has enabled us to do is have really helpful conversations with them about what it really takes to work with many of the challenges that are discussed in this paper. And I think you're right. I think the more we can do that, that gives us a working understanding of how we want to work with the workforce, at the same time as ensuring that we understand what it takes to create work within those conditions. Thank you.
Very, very good point, Michelle. Jo.
Hi, thank you for your report. And just following on from what Councillor O'Doherty has said, in 3.3 you say Baines now pay an hourly rate for home care that meets the thresholds recommended by the Home Care Association. But what is the hourly rate?
Okay, so the hourly rate recommended by the Home Care Association, I believe, is £25.57, which is about what we're paying. But it is a moot point, because at the end of the day, there are different rates given for a half hour, an hour, and for weekend rates, etc. And the Home Care Association have encouraged us to look at those as separate rates, so that is the combined rate when you look at the average across those different sets. So now as a council, that is our starting point. It's described as our fair price of care. So some of our providers still charge us more than that, some of our providers ask for a little less than that, but when we go out to the market and ask for care, that's the fair price of care point that we ask for.
Okay, all right, and then it says creating BSW Academy Domiciliary Care Steering Group. Can you expand on what that means?
Yeah, sure. Suzanne Westhead was able to work alongside and with our ICB to really explore some of the challenges within domiciliary care at the moment, sometimes referred to as home care. They tend to be used interchangeably. I think because largely this time last year we were really up against it. We couldn't get care for love nor money. Following the COVID and the Brexit situation, we couldn't find carers. People were waiting huge amounts of time for care. So Suzanne felt it was really important to explore what we could do, as Councillor Doherty was suggesting, to, as an anchor institution, look at how we could support the workforce. So that's been set up with Dr. Sarah Green, who now has a brief across the ICB, the Integrated Care Board, to look at how we can support the workforce. We're taking it steady steps, but again, the providers have welcomed that opportunity to engage with us on supporting the workforce.
Okay, so I had a question to myself. Is this useful? Has this steering group been useful?
It's still in its early stages, so I think we've got more work to do. We do offer providers a range of opportunities to discuss what the challenges are, as well as the Care Skills Partnership, which particularly support them around the issue of how many people are trained and are able to access that training. But it is a difficult workforce, as I say. It's a lot of people who move on quite quickly. It's still got one of the highest turnover rates in terms of our workforces across the country, and therefore enabling people to get equipped with training can be tricky.
Okay, and then finally, in Agenda 6 on risk management, it's sort of like, oh dear, this looks worrying. So, normally when you read a paper and you see risk management, there's not much to see, but your paper clearly has a lot to see. This is a really serious issue.
I think you're right, and it's one of the reasons I was really grateful to be able to bring this paper to you. The number of older people needing care is going up year by year. The amount of funding being made available to is not keeping up at that rate. And of course, knowing that the many workforce challenges, when we talk about hospitality, retail, who are also trying to draw from the same group of people, it is a significant challenge, and therefore I think it's important that we, as both the Council and ICB, are focused on that. And that goes back to the Academy, that while we may not be making huge levels of progress, I think we've got to get in there, we've got to be involved, and again, calling upon ourselves as an anchor institution to bring what we can to the market to support that.
Which then comes back to what is your hourly rate, and then how you describe that. Even to my brain, I'm not the best at maths, is complicated, so I just wonder what that would mean to the average person in the street.
In terms of the average person on the street, most of our care workers are still on minimum wage, and that I think is an important challenge. Goes back to your point, that is a challenge to actually ensure that we're paying people appropriately. It is an incredibly skilled job, which is much underrated in terms of what it brings to the many people across the country, and particularly here in Baines. So yeah, I think the financial rate is one thing, but it's also about good terms and conditions, and that's one of the things that, as I say, we've been exploring with United Care Baines, is to actually say, how do we not have to work with hourly rates where people don't know where their next salary is or wage is coming from, but equally so understanding this workforce, which is often people who have caring responsibilities, either for older people or children, and they are genuinely working around, can they get back for 3 o'clock in the afternoon to pick up their kids, and therefore they're not looking all the time for structured ways of working. So I think the understanding and involvement in what it takes to be a care worker is really important.
And then going back to what we said earlier about pensions, where do they sit in terms of pensions, and can that be something that we could work with as a council that gives people a sense that they've got something that is beyond just the pay packet today?
Really important that actually we are supporting people and supporting our provider organisations to work well with people. We've had a number of funds from government over the last 3 months called the Market Sustainability Fund, where the government has recognised that there is a need to put money into the workforce directly, and we are working with providers to ensure that that does get to them, and that actually we're having those conversations with them about good terms and conditions. Having said that, we're not able to enforce that, so it is still up to a provider to work and to work positively with their workforce, but we do know that they're able to work better on that basis. Sorry, Anne, do come in.
Thank you. I just wanted to answer your question about what the workforce does get paid. Judith's absolutely right about the private provider market, and that what I would say as a council who has a significant workforce providing directly delivering care, as I say, through our domiciliary care services, extra care and care homes, and the staff that are coming to us. We've taken decisions some time ago to pay above the national living wage. We actually pay above the real living wage as well. So as a council we are paying above that, and will continue to do so. It's important to do that. It's important to value our staff. They do a very tough job, and alongside that they do get access and offer to our pension scheme as well, and all the other benefits that come for working for this council.
Thank you.
Thank you very much. First of all, I just declare an interest in the fact that me and my wife support a lady in Wiltshire, and so we work quite a lot with care. What is in this? And you've got supporting specific recruitment with prime and anchor providers. What is your definition of a prime and an anchor provider?
There are various papers which have been trying to describe that. It's a term that's recently come into guidance that we've been receiving, but I would say, broadly speaking, it's those organisations which are significant players in the locality. So we would count here RUH, HCRG Care Group, ourselves, the ICB as a body, so those bodies that are able to influence and engage. And I mean, we were also talking about some of the housing organisations, many of those who you will see who are representing those key bodies.
And do we have a list of all the providers that we use to give care to our clients around the area?
We do.
And how is that list reviewed, and how is that list evaluated on a regular basis?
Okay. So my job as Commissioner is to ensure that when new providers come on board that we assess them. So we have something called a framework, and in that framework there are a set of terms and conditions and questions that are asked of new providers about how they go about their business. So we're talking about their quality, the money, their insurance, and a whole range of questions. Once they come onto our framework, if they pass all those questions, we then regularly meet with them every year with at least an annual review of all providers. We also RAG rate them, so if they're struggling, we also will know how well they're doing. We work very closely with CQC, who we meet with on a weekly basis, and so we'll work closely with them to ensure that those providers can be at the best they can be.
One final question. So, if I heard correctly, in answer to the previous question, in relation to other providers, we pay our carers well, perhaps not fantastically, but above minimum wages. How do those pay rates compare with the anchor providers that we use?
I'll let Anne come in as well, but we do pay slightly above, and our terms and conditions are, I would say, probably the most attractive point in our terms and conditions in relation to Councillor Wright's question about pensions, etc. It's particularly there on pensions and holiday that we do tend to come out better, but at the moment the pay rates are slightly above those that are seen on average for the rest of the workforce.
And
So if our payment is better, how come we're failing to attract everyone to come through our system and therefore having to use these ancillary people that don't pay and have such good terms?
What is the
blockage there?
But I would say it's more to it than just money. So when care workers come in, a lot of the time it's about how close is it to where they live, what are the arrangements, the times, the hours that work alongside their other commitments, can they got the flexibility that they're looking for. And so it's more than just the money. Money's part of it, but it's not everything, I think, when we're on those sort of lower wage levels.
If I just add on to that. So just on the pay comparison, so Judith's right in terms of where we pay well in terms of the care workforce. Where we are struggling to attract and where we're doing some work is around registered staff, so registered nurses in particular, which we talked about in terms of things like Charlton House and others. So we're just looking at the pay for those. I think it's fair to say that all agencies are struggling to recruit, and we have just undertaken a lengthy consultation with our care staff around shift patterns. Our shift patterns were very disjointed, lots of different shift patterns across lots of different extra care settings. The staff had asked for particular shift patterns, so we've consulted on that, and we are going to implement that, which will suit most staff. They'd asked to go to 12 hours, which 6 and then 6 and then 10-hour nights. We're hoping again that will be more attractive to individuals, but also sometimes the rurality of where our residents live and the ability of individuals to drive also impacts. So we've developed things like walking grounds where we're trying to recruit from people within the local community. But again, all of that is continued work.
Thank you. I'm not seeing any other questions, apart from Liz again, who's just quietly puts her hand up next to.
I like to leave it till last and give everybody else a chance, but I mean some of the questions that have been asked by Councillor Wright and Councillor O'Doherty in particular have been really spot on, and some of the things I would have asked, and it's really good to be reassured that we are doing our best to attract people, especially with the pay rates and conditions you're talking about, and pension rights and things like that, and also training, because as Councillor Doherty has said, it really recognising the importance of training would make people want to stay. I assume it means they get more money if they're trained. So it's a kind of a win-win situation. Judith, you've been very honest, and I'm worried about your paragraph, but your honesty in saying this, and its resource implications, finance, 5.1, where you say there is a chance that we as a council cannot meet our statutory duties. Now, I'm assuming it's not just our statutory obligations to provide care and offer this at best value to the individual. That maybe it's the best value to the individual bit, but
having done that, we've also created a bit of comment about it from the social care angle and the health angle. And it is interesting that the work we've been able to do has meant that the number of people waiting in hospital here in Baines has significantly reduced. So we have been able to stay on top of that agenda. However, as Laura was saying, we are about to go into winter. We hope that we'll be able to continue to be able to do that. It's nearly always our most challenging time. But I think we're starting from a good position, but you never know what's going to come around.
Have an impact as well, isn't it? I'm not sure you can even answer that question.
There are slightly rising numbers at the moment, but care testing is in a different place at this point in time. But I think I would certainly consider it alongside flu. Flu continues to be one of our main challenges any winter. So I would always continue to take people, get your jabs.
Well, I already have my flu jab, so well done me. Thank you. Are there any other points anybody wants to raise? I thought Kevin would want the last word.
Sorry, problem being a head teacher, obviously. Can I just a reflection, I suppose, but on the risk element, which seems to keep cropping up again, and the fact that we're never alone, just wondered how and what point do all the local authorities say to the government, we cannot meet these statutory concerns unless you give X? Where does that point ever get reached? Does something ever happen that you say, I'm taking you to court because we're not funded to do this, or do they do it the other way around and take you to court for not funding it?
So if I can answer that one, I think it's an ongoing and live conversation with national policy makers and funders, and I'll give you two live recent examples. Last year, ourselves and all the other councils were asked for the first time, following the Fair Cost of Care national exercise, which was looking at home care provision and care home provision across England. It was a national mandated exercise. On the back of that, we were asked to develop a market sustainability plan. And the policymakers' question was, have we given you enough money to meet the demands of the market? And the answer from the sector was no, because there isn't enough money nationally. We welcome all of the additional resource. We are spending it really, really prudently. We've spent it all. And it is quite clear that the market pressures, whether it's the workforce, training, cost of living, cost of materials in delivering some of the care services, it's not just about people, it's about infrastructure and other costs. It's not enough. So it is a national issue. Our duty as a council is, and as officers, to advise yourselves and the cabinet what it takes to deliver and sustain care provision as is currently, and what we may need extra if either the ambition is higher or there are some significant challenges and risks to keep what we've got. And during the year, the Association of Directors of Adult Social Care, as representatives and the voice for the sector, alongside the local government association, who came and did our peer review, because they are the experts in local government, the directors do twice a year an annual survey. And the question there is, can you assure yourself and your authority that you can meet the statutory duties? And it is both in terms of practice and workforce, but also in terms of the cost of delivering the duty. And we are drafting the autumn return to the survey now, so we will be using all of the information we have reported today, because this is part of scrutiny. Are we on target with assessments? Are people receiving good quality, safe care? And can we afford the care which is keeping people safe in their homes? So it is a live conversation, whether it's the budget setting or the sector twice a year report. And I sort of was a bit maybe quiet earlier because it's a live conversation. I want to assure you, you have been part of the peer review.
maybe not in a one-to-one with the peer reviewing team, and we will report on that because it's a valid point, but we have written in all of the papers and self-assessment the role of scrutiny. You are seeing the same numbers that anybody else is seeing, and this is really good and honest conversation, and that's why we were not surprised to hear back that we're not just self-aware, we're self-critical, because we are ambitious, but we are the first to say what would it take and can we do more and what would that look like. So I just wanted to give that assurance. We'll take the point, there are other ways to get you more proactively involved, but this is a scrutiny conversation, and it's quite rightly so, and that has been played into our self-assessment, and you'll see it when you see the report.
Thank you. Does that answer your question, Kevin?
In most parts, the problem I always come across is when is the line drawn, and nobody, as an individual school, I didn't want to say to parents, I'm not offering the care you should be getting. How are you saying, well, you wouldn't probably turn around and say, oh, well, I'm not offering the care I want to give to X, Y, and Z? Or are you? And who's getting that conversation? Because all we hear is the financial is this, and the financial is that, and the financial is a problem, and we don't have enough people here, and we don't have enough people there, but we're making it work. And how long, who's making it work? Who's the squash person in the middle making it work? And when will that break?
No, absolutely. And one lever we've got, lever of control, where we can make a difference, is to be very clear with the market what we can and cannot afford, but also to be very clear where our highest risk points are. So the conversation we just had about the risk session. So our market sustainability plan is published. It is in the public domain. We can attach link to that, to the notes of the meeting. And for this year, within the additional funding we were given nationally for this purpose, we strategically made it very clear. We said we recognise and sustain that we are paying comparably high rates for home care because we need more home care. Our strategy is to support people at home. It's better for the individuals, it's better for their families, it's better for the taxpayer. It does cost overall, but it is a strategic priority in Baines. Because we haven't got enough for everything and everybody, and because we are paying quite high rates for care home provision, and we have too much of low-level care home provision, we signal that to the market. They may not like it, but they need to know that our responsibility is to the whole of the population and to the whole market. Other councils have done the same. I've recently reviewed a couple, and those messages are quite clear. Our job as commissioners is to work with the market and see who wants to deal with us on the terms of our policy and our financial responsibility. But it is a challenging market, it's a challenging situation. And actually one area in which I would welcome your input proactively is how we work with the self-funders in Baines, because as you will see from the peer review, and as we have recognised, we all have a role to play to educate and inform Baines residents about the right times to start asking for formal assessments, how we can all help each other and our families to be independent, active, so we don't too early realise we actually missed an opportunity and now it's more costly and some of it cannot be gained back. So that would be a fantastic future conversation through here, because we're just beginning to think about what to do next. There isn't a plan, there isn't a report, but we definitely need to put our heads together and actually collectively say what is the message to Baines residents, because if we do nothing, it's going to cost us more in 2 years, in 5 years, definitely in 20 years, and we don't want to be in that situation.
Thank you, Natalia. I think we'll bear that in mind when we are looking at our work plan as well. Alison.
Yeah, I just wanted to add, in terms of messages going back up to the government about where we are and how difficult things are, I have regular meetings with people in a similar role to me across the southwest, and I'm aware that we are not unusual, and in fact I think we're probably, because of the work that we've done over the last year or so in terms of growing our home care provision, we're actually in a better position than a lot of places. But all that information, those meetings are hosted by the LGA, and that intelligence is used to feed back to the government on an ongoing basis. So I think those messages are taken back. It's, whether the government is listening, but, I think we're all aware that there are a number of local authorities that are effectively going bankrupt currently. And I think as more and more of those take place, that happens, I think the government will have to start to listen. So I'm cautiously optimistic that something will have to be done about funding for social care services, because it's not sustainable to keep it at the levels that it's been in recent years.
Thank you, Alison. Okay, I'm now going to move us on to our final item, which is the panel work plan. And obviously throughout the course of this meeting we've had a number of additional items to add. So I just really wanted to take you through what I've noted, and then we can add those on and see if there's any other comments that people would like there. So we had an invitation to the chair of the ICB. Yes? Okay. School meals, I think, came up. That was actually before the meeting, wasn't it, I think? So, Chris, would you like just to
Can we have a report on school meals, please?
Is there anything in particular you'd like that report to be focusing on? Are we looking at
cost,
value for money?
Yeah, value
provision?
for money, provision.
Who provides
and
all
who
of those
provides,
things?
etc. Yes, yeah. And take up.
And possibly also
free school meals as well as actual meals. Yeah.
Yes, yes.
As well as total, rather.
I'm having a sense of deja vu. I remember at an earlier, many years ago, we had a very in-depth look at school meals, didn't we?
We did, yeah.
Yes.
Yeah.
Mm.
Yeah.
Okay. Also, we have the question about. I've written it down as better staffing, but I'm not quite sure that's quite the right title, Michelle.
It's sort of around. I don't know. How do we build a sustainable workforce, or care workforce? I suppose.
Okay, and then we've had several references to dental services and also to mental health. I don't know whether we ought to consider, perhaps alongside our maybe around our budget meeting, but maybe one session that looks at issues that cover both children and adults, rather than a somewhat artificial division on some of these areas. Send ICB and young carers. I think that came from you, Kevin. Is that that's probably not enough of a definition, is it?
Well, it was the role that the ICB SEND member plays, and how they work with SEND across the authority.
Okay. Anything else that I've missed from this meeting, or you want to add in?
I did mention pharmacies because similar to dental provision, the ICB is now organising the number of pharmacies in our area, and a number have closed down. And I think it's an important thing to look at, especially as I think I said, pharmacies are taking they're being used to stop people. Well, not stop people, but to, instead of going to see a doctor, we are all encouraged now to go to a pharmacist, and if there are fewer of them, less of them, it will be a problem for some people.
Mm. Okay. Can I just say in relation to pharmacies that a report went to the Health and Wellbeing Board about pharmacy provision within the last year. I think it's a statutory requirement to do it on a regular basis, so it reviews pharmacy services across the area, so that might be a useful starting point.
Thank you.
Thank you. Joe, and then, sorry.
Oh, sorry. Self-funders was raised?
Self-funders, yes, of course. Okay. Jo?
It's sort of a children's one as well, but I've recently heard a statistic that children with complex needs take up 30% of the NHS budget. And it's just how does the local area support that and what happens around that 30%? Because it's a massive amount of money in terms of the ICB. Yeah, I'm just considering. Well, it's a large percentage, and often parents complain that they don't feel that they are being supported with the complex needs that their children manifest. So even though we're spending all this money, are the adults who are surrounding those young people being supported, and are those young people's voices and what they are requiring being listened to?
In a way, that fits in with a suggestion I was going to put forward, which was around EHCPs, which, as I'm sure many of us will know from our work as counsellors as well as in other roles, although it seems to take a really long time to get an EHCP. So this is a educational healthcare plan, and then once one is in place, it also takes a long time for the elements to be delivered, and it might be worth exploring that. So I wonder if your thoughts might sort of fit in there somewhere. Okay. So in that case then, does everybody generally in agreement with adding EHCPs? Yeah. And why, yes, the issues around those. Okay, so that's in addition to, we've got already on our plan, education performance update, the budget, COVID, the impact of long COVID across our communities, COVID, care home studies, child sexual exploitation, community resource centres consultation, and homelessness health. So those are all items that need to be given a date, but we currently have on our 11th of December meeting food poverty, and we don't think we've got anything yet in our November meeting. We'll certainly nothing on our work plan, so we can arrange some of those items to be on that. Well, Kerry and I and Liz will be meeting on Wednesday to discuss. So is there anything else that people would like to see on the work plan that we've not covered, anything that maybe we've made a reference or officers have made a reference to that we've not picked up on? Okay, well, if anything occurs to you, obviously, please contact myself, Liz, and Kerry, and we can make sure that that is then put onto the plan at an appropriate time. In that case, then, I apologise. I did say we'll be finished at 12. I'm 20 minutes over, but still 10 minutes under our actual cut-off time. So thank you, everybody, for your attendance. Thank you particularly to officers and the Cabinet member for your input into our conversations as well.